Vulnerable populations include the economically disadvantaged, racial and ethnic minorities, the uninsured, local-income children, the elderly, the homeless, and many more. The disadvantages of these populations create a lack of resources or a lack of choice that could impact their health and wealth. According to Columbia University, children represent 24% of the population, but they comprise 34% of all the people in poverty. Among all children, 45% live in low-income families, and approximately 1 in every 5, which is 22%, live in poor families. There are nearly 24 million young children under 6 years old in the United States. 49%, which is 11.5 million, live in low-income families. 25%, which is 6 million, live in poor families. In recent years, the percentage of young children living in low-income families, both poor and near poor, has been on the rise, increasing from 43% in 2006 to 49% in 2011. Children that come from families of low income are put at a disadvantage because they do not get the same opportunities as other children from more financially stable homes. Some of the opportunities these children lack that concern health is with diet. According to research done by Harvard University, healthy diets cost about $1.50 more per day compared to unhealthy diets. Families that have less of an income do not always have the option of choosing between healthy fruits and vegetables or unhealthy donuts. A donut only costs 99 cents, while a mixed fruit package costs around $10. Although most families want the best for their children, low-income families have to make the most financially of what they have. This might involve having to give up some healthy food choices to be more financially stable. These dietary choices can lead to future health problems. However, among all young children under 6 years of age, approximately 8% in low-income families and 7% in poor families are uninsured. 73% of children under 6 years old living in low-income families, which is about 8.4 million, are covered by public insurance. These statistics show that not only do these low-income children get a lack of dietary choices, but when they get sick or injured, these children do not have the same opportunities for medical care to get better. A way that low-income children are affected in terms of wealth is by school. Low-income children may not be able to afford as nice of schools. Although many public schools have good education programs, if the education was better at another school, public school could potentially be the low-income child's only option. Children from higher income families have more of a decision to attend public schools or private schools. Higher income families can often pay for services for their child, such as tutoring, which can help their child get better grades and ultimately help them go to a good college. Low-income children are often in a public school and cannot afford any outside assistance for their education. When it comes time for college, lower-income children cannot often pay for college since college is so expensive. The increasing price for college makes it difficult for anyone, let alone those who come from a lower income, to attend and then in later years pay back their debt. The lack of education lower-income children are getting throughout their years affects their wealth because jobs look at education. The better paying job comes from a higher education. A lack of degree or diploma is proven to result in a generation of lower income families. 82% of children whose parents have less than a high school diploma live in low income families. 52% of children whose parents have a high school diploma but no college education live in low income families. Only 24% of children whose parents have some college education or more live in low income families. In order to make more money, the future of low-income children is put at a disadvantage from when they are young. They are set up to potentially make less money in the future and not get as good careers for their lives solely because of when they're a child they don't have the same opportunities as others. It is evident that low-income children are a vulnerable population that is being affected in both areas of health and wealth. However, this issue does not need to go unresolved. A possible resolution for this issue is to put in government-issued programs for low-income children. Some of the programs that could be implemented are a way for low-income families to ensure that they are receiving healthy food in at least some part of their diet by if the family has enough income per year, the government will supply them with the healthy food. A way to help the wealth issue is to provide additional scholarships to low-income children who want to go to college and assisting them throughout high school with free tutors to ensure that they will have the help that other students can get. Even though low-income children are at a disadvantage right now with health and wealth, it does not mean that this always needs to be this way. In conclusion, low-income children are at a disadvantage. Health-wise, they often do not get to choose healthier dietary choices or medical insurance to ensure care of diseases. Wealth-wise, they often do not get the best education, which in turn could result in decreased salary and career opportunities in the future. However, it does not always have to be this way. There are solutions such as implementing systems where low-income children are given healthier food options and services to help them through school. Despite their families' incomes, they deserve the same opportunities as everyone else.